Well, struggles with mental health are on the rise globally. Last year, the World Health Organization said 1 in 8 people around the world live with a mental health condition. That's 970 million people, up from 900 million the year before. Depression and anxiety are the most prevalent conditions. Last year, 5% of adults had depression and 4% had anxiety. So at least 1 or 2 people in every 30 are dealing with these challenges. And this also affects the workplace. Depression and anxiety cause a global loss in productivity of $1 trillion every year. Support for these conditions is growing, though. Last year, the global mental health market was valued at over $450 billion. It's predicted to be worth $623 billion by 2032. And technology is playing an increasing role, with tens of thousands of apps available, increasingly using artificial intelligence to tailor responses to those seeking help. Well, let's talk now to Bethany Teachman, who's Professor of Psychology at the University of Virginia. Good to see you, Bethany. Welcome to the programme. So we're seeing...
Thank you so much for having me.
Welcome. We're seeing a big rise in these digital tools, aren't we? They're very popular, but do they actually work? Do they do the job?
They can. So we have some nice evidence that the digital tools that are based on research and using principles that we know can really help deal with anxiety and depression, particularly cognitive behavior therapy principles, can work just as well in some cases as in-person care. Now, that doesn't mean that every app you pick is going to be effective, though. So it's really important that people are getting the right program that can actually help their needs and is based on solid research.
There must be a concern, though, that some of these apps will essentially miss important things that real qualified professionals wouldn't miss.
Absolutely. And so one of the things we think about are stepped care models. So the idea being that if you have maybe less serious problems, or you have problems that are not likely to lead you to have an acute crisis of some kind, then it may be appropriate to use these devices. If you're dealing with something that's maybe more complex or more serious, it may make more sense to be pulling in that in-person help. But we also try to think about it as not either or. So some of the work that's happening that I think is really exciting is using blended care models. So if you think about it from the standpoint of, let's say I'm doing a treatment for social anxiety disorder, I might need to see somebody 16 times. That's a lot of time. If we use these digital tools, maybe I can see the person 8 times, and the digital tool can do some of that work as well, so that we can have much more efficient care models in what we're doing. So there's lots of concerns we need to manage with it, but given how poorly we're currently meeting mental health care needs in terms of the high prevalence and lack of personnel to be able to meet those needs, it's really important that we think about these innovative care delivery models to increase access.
One thing we are seeing a lot more of is AI chatbots being used for emotional support, if you like. How does that actually work?
Right. So it provides a platform for people to kind of go back and forth and get that immediate feedback. And I think we have lots of open questions about the ethics, about the dangers of that, but also the potential for that, right? So I think of those as tools. And just like any tool, we want to be careful. We want to make sure that they're safe and appropriately regulated. And I think there are lots of open questions in this space. But we can also think of these tools as doing more than just sort of the chatbot therapy idea. So that's one avenue that, if we can work on the safety issues, could really increase access to care, but it's not the only role. So we could see, for example, AI playing a really big role in assessment and diagnosis, something that takes clinical providers a lot of time to do. And some of these digital tools may be helpful in those spaces. It may be helpful in training the mental health care workforce. It's probably going to be really helpful in making it easier for us to personalize care for people. And that's something that my research team is working on. So there's lots of ways we can think about using these tools that can help us to manage the safety risks that are involved, but also think about ways they can really make delivering care more effective and more efficient.
You mentioned the ethics surrounding this and the possible dangers, one of them being privacy, people uploading this very personal data to these chatbots. Is that something we should be worried about?
Absolutely. I think it's important that people are really taking those issues very seriously and really watching that there aren't companies or governments who are inappropriately sacrificing our privacy in those ways, because obviously these topics are incredibly sensitive. So I think it's absolutely important that we think about regulations in that space and being really careful in what we're doing. I will say, though, that there are also offline versions of these programs. So in the work that we're doing, for example, we never upload any information about individuals into the OpenAI platforms, never. And we have no intent in doing that. So there are variations we can do and think about that can still get us those benefits while thinking about ways that we are being really careful to protect privacy. And we need lots of monitoring to do this well, because the 24/7 access that these programs provide is part of what makes them really potentially helpful, but also where the risks come in, because if you're not monitoring and it's middle of the night and somebody's having a really difficult time, there isn't a human in the loop. And so we have to be really careful about how we work to do this in a way that protects people while taking advantage of the benefits that these programs can offer.
Bethany, great to talk to you today. Thank you so much for coming on the programme. That's Professor Bethany Teachman from the University of Virginia.
Thank you.